What do you see in this image? Here I see a right internal ureteral catheter with the distal pigtail laterally displaced. This finding indicates a malpositioned internal ureteral catheter. On the image, the catheter is supposed to be within the renal pelvis, but instead it's lateral and out of the expected path. There are no differential diagnoses here. It's an Ant Mini. A cystogram is diagnostic in this case. The next step in radiological management would be to confirm the malposition with a cystogram and reposition the catheter correctly. Let's move to the next case. What abnormalities do you notice in this image? This image shows a low attenuation right renal mass with internal septations and enhancing margins. These findings are indicative of pyelonephritis with a pararenal abscess. The mass effect on the kidney and the presence of enhancing septations within the lesion suggest infection and abscess formation. Differential diagnoses include a renal neoplasm. To further evaluate, a contrast-enhanced CT scan can help differentiate between infection and neoplasm. Management involves antibiotics for the infection and possible drainage of the abscess. Let's move to the next case. What do you see in this image? This image shows multiple enhancing hepatic lesions, enlargement of the celiac and hepatic arteries, and cardiomegaly. These findings are characteristic of infantile hemangioendothelioma. The hepatic lesions are well-defined and hypervascular, indicating a benign vascular tumor. Differential diagnoses include cavernous hemangioma, which rarely occurs in infants and is usually seen in older children and adolescents. To further evaluate, an ultrasound with Doppler can help assess the vascular nature of the lesions. Management typically involves monitoring, as these lesions often regress spontaneously, but in severe cases, corticosteroids or interferon therapy may be necessary. Let's move to the next case. What abnormalities do you notice in this image? Here I see echogenic medulla in the kidneys, which is a manifestation of medullary nephrocalcinosis due to renal tubular acidosis. The medullary pyramids are markedly echogenic, indicating calcification. Differential diagnoses include distal RTA, medullary sponge kidney, long-term Lasix therapy, hyperparathyroidism, hyperoxaluria, and hypervitaminosis D. To further evaluate, a serum electrolyte panel and urine pH can help confirm renal tubular acidosis. Management involves correcting the metabolic disorder and addressing the underlying cause. Let's move to the next case. What do you see in this image? This image shows distended bowel loops, pneumatosis intestinalis, pneumoperitoneum, and portal venous gas. These findings are indicative of necrotizing enterocolitis. The bowel walls are thickened and contain gas, which is abnormal. No differential diagnosis is needed here. It's an Ant Mini. To further evaluate, an abdominal X-ray can confirm the presence of pneumatosis intestinalis and pneumoperitoneum. Management involves immediate surgical consultation, bowel rest, and broad-spectrum antibiotics. Let's move to the next case. What abnormalities do you notice in this image? This image shows a distended, blind-ended viscous 6 mm in total thickness, non-compressible, with surrounding phlegmon. These findings are characteristic of appendicitis. The appendix appears swollen and inflamed, with surrounding fat stranding. Differential diagnoses include intussusception and a mass lesion. To further evaluate, an ultrasound can confirm the diagnosis in thin patients. Management involves surgical consultation for appendectomy. Let's move to the next case. What do you see in this image? This image shows a paucity of gas and a focal dilated loop in the RLQ. These findings are indicative of intussusception. The telescoping of one part of the bowel into another is evident. Differential diagnoses include other causes of bowel obstruction. To further evaluate, an air contrast enema is diagnostic and therapeutic. Management involves performing the air contrast enema under fluoroscopic guidance, with surgical backup in case of perforation. Let's move to the next case. What abnormalities do you notice in this image? This image shows a thickened and elongated pyloric channel with no passage of ingested liquid. These findings are characteristic of hypertrophic pyloric stenosis. The pyloric muscle is hypertrophied, leading to obstruction. There are no differential diagnoses here. It's an Ant Mini. To further evaluate, an ultrasound can confirm the diagnosis with measurements of the muscle thickness and pyloric length. Management involves surgical pyloromyotomy. Let's move to the next case. What do you see in this image? Here, I see a suprarenal mass of low attenuation that is isointense on T1 and hyperintense on T2 imaging. These findings are indicative of a pheochromocytoma. The mass shows characteristic imaging features with marked vascularity. There are no differential diagnoses here. It's an Ant Mini. To further evaluate, a 24-hour urine collection for catecholamines and metanephrines can confirm the diagnosis. Management involves surgical resection of the tumor. Let's move to the next case. What abnormalities do you notice in this image? This image shows a large, gas-filled viscous filling the pelvis and abdomen, pointing into the pelvis. These findings are characteristic of a sigmoid volvulus. The classic coffee bean sign is evident. There are no differential diagnoses here. It's an Ant Mini. To further evaluate, a CT scan with rectal contrast can confirm the diagnosis. Management involves endoscopic detorsion or surgical intervention if there is evidence of bowel ischemia or perforation. What do you see in this image? Here I see enlargement of the superior mesenteric vein, SMV, with an intraluminal filling defect and surrounding fat stranding. These findings indicate subclavian vein thrombosis. The SMV is visibly enlarged, and there is a clear area where the blood flow is obstructed by a clot, causing inflammation around it. Differential diagnoses include bowel infection and hypercoagulable states, but the presentation is quite classic for thrombosis. To further evaluate, a Doppler ultrasound or contrast-enhanced CT scan can confirm the diagnosis. Management involves anticoagulation therapy to prevent further thrombus formation. Let's move to the next case. What abnormalities do you notice in this image? This image shows dilated loops of the small bowel with decompressed distal loops and colon. These findings are indicative of small bowel obstruction. The small bowel loops are significantly dilated, indicating a blockage that prevents the passage of contents downstream. Differential diagnoses include adhesions, post-op, hernia, and mass lesion. To further evaluate, an abdominal X-ray or CT scan can help identify the cause of the obstruction and confirm the diagnosis. Management involves nasogastric decompression, IV fluids, and surgical consultation if there is no improvement. Let's move to the next case. What do you see in this image? This image shows gas and oral contrast within the bladder. These findings are characteristic of an enterovesicular fistula. The presence of air and contrast in the bladder indicates an abnormal connection between the bowel and bladder. Differential diagnoses include diverticulitis, Crohn's disease, and invasive tumor. To further evaluate, a CT scan with oral and IV contrast can confirm the fistula and help identify the underlying cause. Management involves treating the underlying condition and surgical repair of the fistula. Let's move to the next case. What abnormalities do you notice in this image? This image shows a hypoechoic, hypovascular intratesticular mass. These findings suggest a testicular hematoma post-sperm harvest. The mass appears as a dark, less vascular area within the testicle. Differential diagnoses include testicular carcinoma, epidermoid cyst, and abscess. To further evaluate, a follow-up ultrasound can help monitor the resolution of the hematoma. Management typically involves observation and supportive care, as most hematomas resolve spontaneously. Let's move to the next case. What do you see in this image? This image shows non-visualization of the right upper pole of the kidney and a drooping lily sign of the lower pole, with mild dilation of the lower pole collecting system and a distal filling defect, also known as the goblet sign. These findings are indicative of duplex right kidney and distal ureteral transitional cell carcinoma, TCCs. Differential diagnoses include stones and sloughed papilla. To further evaluate, a CT urogram can help confirm the diagnosis and assess the extent of the tumor. Management involves surgical resection and possible adjuvant therapy. Let's move to the next case. What abnormalities do you notice in this image? Here I see the lemon head sign and the banana sign, along with a thoracolumbar meningomyelocele. These findings are characteristic of Chiari-2 malformation. The head shapes are indicative of brainstem and cerebellar anomalies, and the spinal defect confirms the diagnosis. There are no differential diagnoses here. It's an Ant Mini. To further evaluate, an MRI of the brain and spine can provide detailed images of the malformation. Management involves neurosurgical intervention to correct the anatomical abnormalities and prevent complications. Let's move to the next case. What do you see in this image? This image shows a large fat-containing mass in the deep pelvis. These findings are indicative of a dermoid. The mass has fat density, which is typical for a dermoid cyst. There are no differential diagnoses here. It's an ant mini. To further evaluate, an MRI can help confirm the diagnosis and assess the extent of the lesion. Management typically involves surgical excision to prevent complications such as rupture or malignant transformation. Let's move to the next case. What abnormalities do you notice in this image? This image shows the double bubble sign on fetal ultrasound, which is characteristic of duodenal obstruction. The double bubble sign indicates a dilated stomach and proximal duodenum, suggesting an obstruction at the duodenum. Causes include duodenal atresia, often associated with Down syndrome, duodenal web, and annular pancreas. To further evaluate, a postnatal abdominal X-ray can confirm the diagnosis. Management involves surgical correction of the obstruction. Let's move to the next case. What do you see in this image? This image shows an isodense mass on non-contrast CT that intensely enhances with contrast. An angiogram is diagnostic. These findings are indicative of a left hepatic artery pseudoaneurysm. The mass is highly vascular, which is a hallmark of a pseudoaneurysm. Causes include post-traumatic, mycotic, or post-pancreatitis origins. There are no differential diagnoses here. It's an ant mini. To further evaluate, a contrast-enhanced CT angiography can confirm the diagnosis. Management typically involves embolization of the pseudoaneurysm to prevent rupture. Let's move to the next case. What abnormalities do you notice in this image? This image shows an approximately 1 centimeter mass in the right upper outer quadrant of the breast, with spiculated margins and no fatty elements. These findings are characteristic of invasive ductal carcinoma. The spiculated margins suggest an aggressive tumor that is infiltrating the surrounding tissues. Differential diagnoses include post-biopsy scar, complex sclerosing lesion, and fat necrosis. To further evaluate, a mammogram and biopsy are necessary to confirm the diagnosis. Management involves surgical resection, radiation therapy, and chemotherapy depending on the stage of the cancer. What do you see in this image? Here I see tethering of multiple small bowel loops with a soft tissue mass within the mesentery. These findings are indicative of a carcinoid tumor. The desmoplastic reaction causing fibrosis and tethering is quite typical for this condition. Differential diagnoses include lymphoma, fibrosing mesenteritis, and mesenteric metastases with a desmoplastic reaction. To further evaluate, a CT scan or MRI can provide more detailed imaging, and a biopsy can confirm the diagnosis. Management involves surgical resection of the tumor and monitoring for metastases. Let's move to the next case. What abnormalities do you notice in this image? This image shows an in utero renal mass located in the right upper quadrant, which is diagnostic of a mesoblastic nephroma. This is a benign renal tumor most commonly seen in neonates. Differential diagnosis includes Wilms tumor, although it is extremely rare in neonates. To further evaluate, an MRI can be diagnostic, providing clear images of the mass. Management typically involves surgical resection of the tumor. Let's move to the next case. What do you see in this image? This image shows a large filling defect in the distal stomach with contrast in the proximal jejunal loops via an anastomosis to the greater curvature. These findings suggest a gastric carcinoma with small bowel anastomosis. Differential diagnoses include lymphoma, obstructing leiomyosarcoma, and metastasis. To further evaluate, a CT scan can help assess the extent of the tumor and any involvement of adjacent structures. Management typically involves surgical resection and possibly chemotherapy or radiation therapy, depending on the stage of the cancer. Let's move to the next case. What abnormalities do you notice in this image? Here I see an anterior outpouching of abdominal contents, including the liver, contained within a thin membrane. These findings are characteristic of an omphaloceal. This congenital anomaly is often associated with chromosomal abnormalities. There are no differential diagnoses here. It's an ant mini. To further evaluate, a detailed fetal ultrasound can help assess the extent of the omphaloceal and any associated anomalies. Management involves surgical repair after birth. Let's move to the next case. What do you see in this image? This image shows an abnormal configuration of the stomach with the superior location of the greater curvature. These findings are indicative of an organoaxial volvulus. The stomach is twisted along its long axis, which can cause obstruction and ischemia. There are no differential diagnoses here. It's an ant mini. To further evaluate, a CT scan can confirm the diagnosis and assess any complications. Management typically involves endoscopic or surgical detorsion of the volvulus. Let's move to the next case. What abnormalities do you notice in this image? This image shows gas outlining both sides of the bowel wall, known as Wriggler's sign, and gas within the falciform ligament. These findings indicate a bowel perforation. The presence of free intraperitoneal gas is highly suggestive of a perforated viscus. Differential diagnoses for the causes include iatrogenic causes such as a scope, penetrating trauma, a duodenal ulcer, and a giant diverticulum. To further evaluate, a CT scan can help pinpoint the location and cause of the perforation. Management involves urgent surgical intervention to repair the perforation and prevent further complications. Let's move to the next case. What do you see in this image? This image shows enlarged common bile and pancreatic ducts, also referred to as the double duct sign, along with a heterogeneously enhancing mass in the head of the pancreas. These findings are characteristic of pancreatic head carcinoma. The mass effect causing both bile and pancreatic duct dilation is typical of a malignant obstruction. Differential diagnoses include focal pancreatitis. To further evaluate, an endoscopic ultrasound with biopsy can confirm the diagnosis. Management typically involves surgical resection, Whipple procedure, and possibly chemotherapy or radiation therapy depending on the stage of the cancer. Let's move to the next case. What abnormalities do you notice in this image? This image shows luminal narrowing of multiple small bowel loops with an irregular mucosal pattern. These findings suggest lymphoma. The narrowing and irregularity of the mucosa indicate an infiltrative process. Differential diagnoses include Crohn's disease, tuberculosis, and metastases. To further evaluate, a CT enterography can provide more detailed information about the extent of the disease, and a biopsy can confirm the diagnosis. Management typically involves chemotherapy and possible surgical resection, depending on the extent and location of the disease. Let's move to the next case. What do you see in this image? Here, I see an enlarged uterus containing multiple mass lesions, the largest of which is submucosal. These findings are characteristic of a fibroid uterus. The multiple masses within the uterus are typical of leiomyomas. There are no differential diagnoses here. It's an ant mini. To further evaluate, an MRI can help assess the size and number of fibroids. Management involves medical therapy to control symptoms or surgical options like myomectomy or hysterectomy if the symptoms are severe. Let's move to the next case. What abnormalities do you notice in this image? This image shows an abnormal bowel gas pattern in the LQ with a suggestion of a lobular intraluminal mass. These findings are indicative of colocolic intussusception. The presence of a mass within the bowel causing obstruction is typical of intussusception. Differential diagnoses include idiopathic causes in pediatrics, lymphoid hyperplasia, Henoch-Schönlein purpura, HSP, Meckel's diverticulum, and mass lesions in adults. To further evaluate, a CT scan is diagnostic and can confirm the intussusception. Management involves reduction of the intussusception, either radiologically or surgically if necessary. Let's move to the next case. What do you see in this image? Here I see contrast entering the proximal colon on a sinogram and a gas-containing fluid collection in the left flank on a CT scan. These findings are indicative of an enterocutaneous fistula. The abnormal connection between the bowel and skin is clearly visible. Causes include Crohn's disease, diverticulitis, radiation necrosis, and neoplasm. To further evaluate, a contrast-enhanced CT can help map the fistula tract. Management involves treating the underlying condition and surgical repair of the fistula. Let's move to the next case. What abnormalities do you notice in this image? This image shows a large gas-filled viscous filling the pelvis and abdomen, pointing into the pelvis. These findings are characteristic of a sigmoid volvulus. The classic coffee bean sign is evident. There are no differential diagnoses here. It's an ant mini. To further evaluate, a CT scan with rectal contrast can confirm the diagnosis. Management involves endoscopic detorsion or surgical intervention if there is evidence of bowel ischemia or perforation. Let's move to the next case. What do you see in this image? This image shows segmental narrowing of the antrum, known as the string sign, with no obstruction and an incidental benign ulcer of the lesser curvature. These findings are indicative of an antral stricture. Differential diagnoses include benign peptic stricture, gastric adenocarcinoma, lymphoma, and metastasis. To further evaluate, an endoscopy with biopsy can help confirm the diagnosis and rule out malignancy. Management involves treating the underlying cause, such as acid suppression for peptic ulcers, or surgical intervention if there is significant obstruction. Let's move to the next case. What abnormalities do you notice in this image? Here I see enlarged kidneys with innumerable cysts and a large mass within the right upper pole. These findings are characteristic of ADPKD, autosomal dominant polycystic kidney disease, and renal cell carcinoma. The presence of multiple cysts and a solid mass within the kidney is typical. There is no increased risk of RCC in ADPKD, but the mass itself suggests malignancy. To further evaluate, a contrast-enhanced CT scan can help characterize the mass and assess its extent. Management typically involves surgical resection of the RCC and monitoring of the ADPKD. If you enjoyed these case discussions and want to see more, make sure to subscribe to our YouTube channel, Radiology Made Easy. We cover a wide range of radiological cases across different systems, helping you enhance your diagnostic skills. Don't miss out on our latest videos and updates. Click that subscribe button now.